Hi, good morning. I am Dr. Pradyuth Waghray, Senior Consultant Pulmonologist, Apollo Hospitals, Jubilee Hills, Hyderabad. Today, I wanted to discuss on interstitial lung disease. Now, this disease also, the patient presents with cough, but it is dry cough, and they present with breathlessness initially on climbing, say, a flight or two of stairs, and then as the disease increases, they feel breathless even on walking on plain ground. So this disease differs from COPD because here it is not the airways which are involved, but it is called as diffuse parenchymal lung disease. That is, the interstitium is the area between the air sacs. In COPD we have seen that the airways and the air sacs get affected, but in interstitial lung disease it is the area between the air sacs, which is like a cementing bond, which is called the interstitium, that gets affected. Again, the common causes of interstitial lung disease is cigarette smoke or exposure to any form of pollutants, be it industrial pollutants or home pollutants or anything. We don't know the exact cause which causes ILD. What we are seeing nowadays is exposure to birds, especially a lot of pigeon exposure we are seeing, especially in Hyderabad city. And the importance of diagnosing this disease of ILD is because the prognosis and the treatment varies when compared to COPD. Now, in interstitial lung disease, so if you are a smoker or if you are exposed to any industrial pollutants or any other pollutants, or if you have exposure to birds, especially pigeons, and if you present with dry cough and breathlessness, please consult your doctor. He will get a test called HRCT, that is high resolution CT scan of the chest, which will tell him how much of the ILD is affecting your lungs. It has different grades, and depending on that, they will give you the medications. I just want to specify on two conditions. There are so many causes of ILDs, I don't want to go into all the details. Two conditions which are increasing in our country is, one is hypersensitivity pneumonitis and other is idiopathic pulmonary fibrosis. Hypersensitivity pneumonitis is due to exposure to pigeons or birds. Patients present with cough and breathlessness, and then on examination the CT scan will show certain changes, and then your doctor will prescribe steroids for this disease. Similarly, the idiopathic pulmonary fibrosis is the more sinister form of the ILD, in which this affects predominantly males who are more than in their 5th or 6th decade of life. They have history of smoking, and they have certain typical pictures on the HRCT scan of the chest, which will help your doctor to treat this disease. The importance of IPF, that is idiopathic pulmonary fibrosis, is that this is a progressive disease, and there are certain specific drugs available now called pirfenidone and nintedanib which can treat. So these two are different types of ILDs needing different types of treatment. So if you have any such complaints of cough and shortness of breath, and if you are exposed to pigeons or birds, or if you are a smoker, please consult your doctor.